In 2007, about 23.6 million people in the United States had diabetes. 1 million had type 1 and the rest type 2. Type 1 is a problem with insulin production and is common in the younger age groups. 90% of diabetics had type 2 diabetes, which is due to insulin resistance and more prevalent in adults. It is estimated that about 60 to 70% of people with diabetes have mild to severe forms of nervous system damage. The results of such damage includes impaired sensation or pain in the feet or hands, slow digestion of food in the stomach, carpal tunnel syndrome, erectile dysfunction, or other nerve problems. Diabetes is the leading cause of new cases of blindness among adults ages 20 to 74 years old, and the leading cause of kidney failure, accounting for 44% of new cases in recent years. Severe forms of diabetic nerve diseases are a major contributing cause of lower extremity amputations. That's why diabetes can't be ignored or taken lightly. Living healthier and longer with diabetes requires proper diet and exercise. Diabetes is when the body has difficulty using glucose, a natural sugar the body produces for energy, which results in unacceptably high blood sugar levels. People with high blood sugar complain of frequent urination, excessive thirst, weakness, recurrent blurred vision, yeast infections, numbness, and tingling of the extremities. If you think you have diabetes, get tested. If you do have diabetes, there are steps you can take to minimize or even stop the damage diabetes can do. Most importantly, see a diabetes specialist. Testing for diabetes should be done for everyone age 45 and above, especially those who are overweight or obese. Early testing at age 30 or younger is done if there's a risk factor, such as someone being inactive, a family history of diabetes, certain races, American natives, African Americans, Native Americans, Pacific Islanders, gestational diabetes, high blood pressure, and more. When you have been diagnosed with diabetes, the physician's goal is to maintain levels of blood sugar and hemoglobin A1C. This is the average blood sugar level in 2 to 3 months. Within a healthy range, therefore, minimizing complications, eyes, kidneys, nerves, skin, and heart. Diabetes treatment will typically consist of diet, eat 3 meals a day along with 2 to 3 snacks a day. It's important not to skip any meals. Control carbohydrates, including sugar and starch, and keep a record of mealtime, including the kinds of food consumed and the amount. Exercise, staying on a regular fitness program to keep weight off, improve blood sugar, cholesterol, and blood pressure levels. Glucose monitoring. Self-monitoring is critical for all diabetics. Medications, keep current and consistent with all medications, both oral and insulin injections. Oral medications, depending on the type, will either improve insulin production, decrease liver sugar productions, increase insulin sensitivity, delay carbohydrate absorption. Also, keep current with other vaccinations such as influenza, pneumonia, etc., and control your cholesterol and high blood pressure. Personal hygiene. Personal hygiene, especially feet, skin, and teeth, can't be stressed enough. Keep current. It is extremely important for all diabetics to keep regular appointments with their healthcare provider. This includes having consistent checkups and lab tests as scheduled to keep healthy. Diabetes can be controlled and diabetics can have a safe and normal life, but it is important to be under the care of a diabetic specialist.